So the Ashaiman Municipal Assembly, in partnership with the Health Directorate and Crystal, is undertaking this health screening for the whole of the municipality from, that is, the month we launched it, that was in May, to December. And we are targeting 50,000 participants within the municipality. This became of essence when we realized that the sudden deaths were becoming so much within the municipality. So our coming here is to see how the exercise has been going on in the last 4 weeks. It's unfortunate to know that our people are not taking advantage of the opportunity to screen themselves and get to know their health status. I am surprised to find out on my visit that the highest cases that are coming up is the hypertension cases. And these are the cases too that are killing a lot of people within our municipality. So as a municipality that we've come around, we've seen this, we've heard it, we'll go to the office and strategize and see how we can get our people to come out in their numbers to screen. And then if it's validated that we have a lot of hypertensive cases within our municipality, then as a municipality we'll look at what measures we put in place. So I am reaching out to our people that let's take advantage of the exercise. My fellow assembly members, unit committee members, opinion leaders, let us rally the community around. Anytime there is a screening, let's take advantage so that we are able to know our health status within the municipality and then strategize to take care of our health. A healthy mind lives in a healthy body, and a healthy economy lives in a healthy society. Let's work together, and then we'll make Ashaiman proud and better.